Welcome, everybody. I'm excited to have you here. Unfortunately, we're having some technical difficulties right now, which is why we're getting started just a bit late. So unfortunately, we do not have video for my face. So you're just going to have to listen to my voice and look at our slides. But please know if you have questions, you can go ahead and put them in the Q&A as we go. But for this moment, while we're kind of getting people in, if you would please in the chat, go ahead and share your name, where you're from, and your favorite thing about fall. And I'll just share really quickly. I'm Emily Adams. I work for APHSA and I live in Colorado. And personally, my favorite thing about fall is a new thing. We just got peach trees. No, we didn't. We've had peach trees for years and years, and we just got peaches for the first time this year. Oh, chat is disabled. Sorry, I don't know how to fix that. Thank you for letting me know, Dustin. All right, we'll just go ahead and move forward then.
Well, it looks like the Q&A, if you go to chat, it looks like the Q&A is disabled, but if you go to webinar chat, and you can type it to everybody, let me try this.
Okay.
Let's see, does that work?
I see that.
What about everybody? Did folks see that? Because we'll use the chat.
It looks like
today.
You can't type back. Okay.
Okay.
Bummer. Well, think about your favorite fall thing and let it make you happy for a moment. And we'll go ahead and start having this discussion here.
And maybe Jenny, I know Jenny is on. So Jenny, if you can maybe play around with that in the background.
Yeah. That would be great.
Absolutely. If it's not going to affect your ability to present, if you want to go ahead and make me a co-host as well, and I can see if I can go in the back end and see if I can adjust that for you.
Okay. Got it. All right. Meanwhile, we'll just go ahead and keep going. So first of all, for those of you who don't know what APHSA is, we are the American Public Human Services Association. And really, we are a member-led organization. We are bipartisan, and we work to support those who work in human services. And so childcare, sometimes in human services, but definitely a human service. So part of our work is around childcare, which leads us to the National Association of State Childcare Administrators, fondly referred to as NASCA. This is a group of state administrators who work in the Child Care and Development Fund. So their job is to figure out how to make childcare work in their state with those small funds they get from the federal government to have a childcare system. So the main things we do is we offer peer-to-peer opportunities from state to state so that people have a chance to talk to their colleagues, which is probably our most valuable part of NASCA. We also engage with the Office of Child Care, and a big piece of our work is helping others in the country, from legislators, policymakers, and other national organizations, understand the issues from the perspective of childcare CCDF administrators. Nora, do you want to introduce yourself?
Sure. Good afternoon, everybody. My name is Nora Yates. I'm the Deputy Commissioner in the New York State Office of Children and Family Services for the Division of Child Care Services, and I'm the lead CCDF administrator for New York State. Happy to have everybody here.
Thank you so much, Nora. And thanks for joining me today. Nora is going to be here to give a little bit of the perspective of those state administrators who we worked really hard to represent their data and to hear from them what this meant to them. And so she can share some of the experiences in her state around how this went and how it's going. My name is Emily Adams, the Policy Associate for Childcare and Early Childhood Programs here at APHSA. You found the Q&A box, I think most of you, and just know that we will send out slides and a recording as soon as we can. So let's get into it, talking about what's happened over the past with the childcare industry, basically. And we're looking at how the pandemic really highlighted what those of us in childcare have known for decades. Childcare is essential to our economy, yet it's somehow considered to be a private matter for families to figure out financially. The COVID-19 pandemic really brought childcare to the forefront of the national conversation, reminding us just how essential it is to the functioning of our economy. But despite its critical role, childcare has been underfunded for years, probably decades, it's safe to say, from the start, really, making it an unsustainable system. So one of the core issues is that we have a flawed market model. The costs of providing high quality care are not reflected in what the market can bear. So what parents, often, younger families, new parents with small children, are able to pay does not cover the cost of providing high quality care. So that leaves providers generally underpaid, programs underfunded. In the meantime, parents still can't afford the care that they need. Childcare providers at this point are struggling to make ends meet due to low wages. This isn't new. This has always been the case, and it makes it challenging to recruit and retain staff, which leads to program closures or just reduced slots in programs. And of course, as we all know, the pandemic made this much worse. It heightened all of the existing challenges in the system, and it really pushed providers to the brink. When the pandemic, oh, we did get chat. Great. When the pandemic did hit in the spring of 2020, the childcare sector experienced closures due to stay-at-home orders. Over 60% of center-based programs and nearly 30% of in-home providers had to shut down across most states. This left a major gap in care, especially for essential workers who still needed those services. This also led to a financial crisis for many providers who operate on incredibly thin profit margins. The pandemic pushed many of them towards economic collapse, further destabilizing the sector. At the same time, we saw a sharp decline in employment within childcare. 33% of jobs were lost in just the first months of the pandemic year of 2020. This dramatic drop underscored how vulnerable the sector was and also pointed to the urgent need for reform to create a more sustainable system. The federal response to the sudden loss of childcare during the pandemic was marked by substantial emergency funding. We had 3 rounds in March 2020, December 2020, and then January 2021. These investments were designed to give states flexibility in how they were able to stabilize and support their systems. States were empowered to allocate these funds creatively while addressing the local needs of their childcare infrastructure, learning from their providers and families what was most important to invest in. So we know most of the pandemic funding expired last September, but there are some funds that are still available until this September 30th. So last year, many organizations sounded the alarm about the catastrophic impacts of the lack of childcare funding would have. Our administrators at NASCA were having a different conversation. What we heard from our members was that rather than a cliff, we were looking at a slope. The perspectives shared by lead agency administrators shows a more nuanced situation that is resulting in gradually escalating trade-offs in how best to use insufficient resources to meet the overwhelming need for safe, accessible, and high-quality childcare. Now we can go ahead and take a look at the survey. So we got our survey responses from data that we pulled around how states were allowed to use the funds. And then at this time last year in November, there were already reports on how states did use the fund. So that was one place where we got some of our questions from. We also were having conversations with administrators at the time, both about how they use the funds, but also the programs they expected to have to either pare down or completely end. And so we used that information as well, especially around figuring out what the expected impacts might be from CCDF administrators' perspectives. We had 36 states and 1 territory respond, which we thought was fantastic. And we know that states really overwhelmingly use the money for providers. The money's almost gone. And now providers must raise tuition or reduce participation or even close due to poor compensation for a highly qualified workforce. Nora, do you want to tell us a little bit about how that's looking?
Right. In New York, we received $2.3 billion combined of pandemic funding, which we have fully liquidated as of September 1st. And so we did dedicate almost half of those dollars towards investment in stabilization grants and workforce retention grants. Overwhelmingly, the bulk of over $1 billion was spent on bonuses and funding directly to staff. They also used it on professional development, but also we saw a significant increase in wages, like long-term wages. So it was a tremendous opportunity. We collected data to see that the wages were being sustained, but our providers are nervous now with the grant funding ending.
Yeah, and this is really one of the biggest concerns here is around the workforce, and that this reduced ability to this ability to increase people's wages is no longer going to be available in many places. So we did have a return to pre-pandemic levels. I think it's kind of hovering in that area. But Nora, do you want to talk a little bit about some of the like lingering impacts from that sort of initial workforce loss?
Sure. We did see, and we did get reports from providers that the retention grants and the stabilization grants that were going towards professional development and increasing wages were allowing them to retain staff and pay staff higher and start to compete with some of the other, opportunities that are in the communities. And we did hear finally that the kind of workforce crisis and the constant turnover was starting to slow. And that was only at the third round of our workforce retention grant. So it took kind of since 2021 and 2022 to just the one that we just completed, where we're starting to see people who are retaining, more than a year or at least a year. Otherwise, they were constantly recruiting staff. Our directors were constantly recruiting staff. At the meantime, also then subbing into the classrooms and then constantly having new staff, right? And constantly kind of bringing new staff up to speed. So that is a equally stressful environment.
Yeah, and we're hearing that from administrators across the country that really a lot of experienced providers have left or are considering leaving the profession. And so then we have overall a much sort of less experienced profession who are less able to deal with some of the challenges that come along with this work. We know that as a result of all of this, we're seeing increased burnout. We know there are workforce shortages. There have always been workforce shortages, but it's getting more severe. And I think everybody's starting to feel the impacts. And we're even seeing some like downstream impacts where some states are less able to hire for other positions that they usually would use a pool of childcare professionals, for example, licensing inspectors. And if you don't have enough people who are working in licensing, then you're compromising health and safety for your children. So there are some sort of downstream concerns that our administrators brought to our attention. So one thing that did come up, and Nora, do you want to take this one?
Sure. We dedicated the other half of our $2 billion to our child care assistance program, and primarily working on increasing payment rates, going to expanding access and increasing payment rates. So we did do a market rate survey during that time, and payment rates to providers went up, and also expanded access to the 85% of state median income. So those big changes were funded primarily by pandemic investment. And so we were able to balance the $2 billion towards our child care assistance program, expanding access for families and increasing payments for providers, and at the same time investing in providers' workforce. But we know a lot of different lead agencies were looking at expanding payment rates but how is that going to be sustainable after the pandemic money is gone?
So there's a lot of concerns, and these letters went to states in April of 2023, letting lead agencies know that they needed to have their payments rate at least at the 50th percentile of their market rate. For some states, for many states, they already were there. For some states, they were there using pandemic funding, and other states really were not there at all. And so we saw, responses across the board. We did see in our survey that of the 12 states who invested in their childcare system, 11 of those states used their funds to increase their payment rate percentile. So it sort of goes to show you how sort of like federal policy and state policy can interact. A little bit of the struggle we heard from that is that some administrators had already gone to their legislature and said, this happened in April, so that's, getting into the legislative season for some states, and they'd already set priorities around what they wanted from their legislature, and then they had to kind of come back and say, we also need this more money. So that was a challenge for some states.
New York did not receive one of the letters because we set it at the 80th percentile for our market rate, and that's actually in statute from previous legislative sessions. So the governor and the legislature feel really passionate that that should have been in statute. So every time we do work under a market rate survey, so it is kind of a given, and it is in statute that we are at the 80th percentile.
Yeah, that is a great level to be for. That's a great star to shoot for, I think. One thing that I wanted to kind of bring up here is that not just from our administrators, but for those of you who are connected with the field of early childhood education, I think you're probably hearing this in multiple places the way that I have been, which is that we know families are more stressed now. And we know that childcare providers tend to be a strength and support for families that they can rely on, that they share their parenting struggles with. But we also know that children are displaying more behaviors that adults are finding challenging. And so there are a lot of theories about this. There's some question about, this younger children who didn't have a lot of socialization during the pandemic. But I think we all know families are under a great deal of stress, housing costs, inflation. There are just a lot of difficulties that families are facing, and childcare providers are facing them as well. And so the workforce constraints and the stress on the job are coming along with family concerns and stress. And it's just making it really a difficult job, even more difficult for everybody. We did want to point out that many states were able to use federal funds to increase their mental health support, which we know there are a lot of studies dating back, at least 20 years around mental health concerns for childcare providers. We know that at least 50% of providers are experiencing moderate to high levels of anxiety. And we also know that mental health issues strongly correlate with having a low income, and childcare providers have a low income. So we saw a lot of concerns around provider mental health over the course of the pandemic, and then supports from the federal funding went to mental health in 23 states, which I think is fantastic. The downside is very few states are able to maintain this. Only 7 states were able to maintain this level of programming. And there are multiple reasons, including a lack of early childhood mental health providers, workforce shortages there as well. But this is a concern as we see the increased stress for children, families, and providers, that there's less and less support. We are also seeing, and I think many are hearing about, increased prices for childcare. Childcare is becoming less affordable. So as the market rate goes up, even if the state investment is kind of the same, the family cost is still going to go up. So we were really able to stabilize this during the pandemic in this country. Families were able to overall more afford costs of childcare. Many families were able to have co-payments waived. And as Nora was saying earlier, a lot of states were able to expand eligibility and serve more families. Unfortunately, this was a benefit of pandemic related investment and something that I think we're going to see decline.
So we have a fortunate position, and I told Emily this is like hard for us to present on because some of this data applies and some of this data we're really fortunate to be here in New York because we do have such a tremendous support from our governor. And so in her long-term plan for support for childcare, she did include pandemic funding to expand access, like I said, to 85% of state median income, as well as increased provider rates to that 80th percentile. We lowered co-payments, everybody down to 1%. So for families above the federal poverty level. And those are permanent changes to our child care assistance system. And so when pandemic funding ended in last year to this year's budget, the governor invested an additional $700 million of state resources to sustain this expansion and sustain these increases. We have seen a great continued increase in families. That's the most important part of families coming into the system. But I know there are some of our local social service district team members on. We are a state supervised, locally administered system here in New York. And so while this investment is fantastic, it's great that families are getting care, the other stressors on the system, like families finding a child care provider. So it's great that they can go and get determined eligible for child care assistance, but then they don't use their voucher or use the subsidy because they can't find a child care provider. We have about almost 80% of our providers accept child care assistance. So it's not, it's pretty universally accepted, but there's just a shortage of providers, right? Or there's a shortage of classrooms. They haven't opened those other classrooms because of the workforce challenges. So I know our districts, our local districts who do the eligibility determination are under incredible challenges. They also have workforce shortages. They also have investment limited. So they also need additional investments. So it's kind of a system level where myself and our other colleagues in other states examined that these are all wonderful and these investments were wonderful, but with an already fragile system in different pieces, it's been really hard to sustain and really leverage these successes.
Yeah, it's a lot. Luckily, I think in New York, there's less difficult decisions, but there are still a lot of difficult decisions about how to allocate the funds that you have to the best for everybody that you can. We did find in our survey, so this was about a year ago that we did the survey. It was last fall, so a little less than a year, that some of the pandemic related projects and programs or pandemic funded showed up in the final rule as when the final rule came out that now states are going to have to do some of these things. So for example, many states were able to pay providers based on enrollment, but knew at that point they would not be able to continue it. Only 36% felt like they would be in a good place to continue these funds. 14% used COVID funds to pay providers prospectively, so prior to services. And then 77% of respondents said they just don't have the funds to sustain programs where they were able to use grants and contracts for priority populations. So all of these are kind of an indication of where states are in terms of readiness to meet the final rule, which we're finding to be true, that there's this paying prospectively based on enrollment and grants and contracts. These are some of the biggest hurdles in the final rule for administrators right now.
Including New York. Including New York.
Yeah. I mean, I think everybody's struggling because at best you might have some technical issues with it, and at worst you might have some legislative barriers. So
we are enthusiastically supportive of the final rule and the changes to the system, and we do think it will ultimately strengthen the system and address some of the challenges that providers face. The final rule did not come with more funding, right? So it didn't, just like the Head Start final rule, which we are also wildly supportive of, also did not come with increased funding. And we've talked, part of NAFCA is facilitating that conversation with the Office of Child Care. And so we've, expressed this to Office of Child Care, which they acknowledge, of course. But sometimes the changes need to happen and hopefully the funding will follow. Here in New York, those are the challenges for us. Again, we are enthusiastically supportive of paying all of these changes. I think ultimately where these changes have been put into place, they've seen increase in wait lists or statewide utilization of wait lists. We don't have a wait list here in New York. We have one small county who is maintaining like 4 people on a wait list. But statewide, our counties are issuing child care assistance subsidy for families. And so that concern of making these changes and having enough resources to continue to serve at the rate we're serving is the push and pull that we're seeing that I know many of you understand.
Yeah. And so this is some of the further, we had these conversations with administrators who were talking about what they expected to lose as they lost supplemental funds. And so based on those conversations, we asked states, which of these impacts they were anticipating. And so again, this was last fall, and I think we've seen many of these concerns actually to a greater extent than were represented in the survey. There's no question that families both in private pay and in CCDF subsidized care are experiencing higher prices for care overall due to many factors, including programs are really attempting to maintain those higher wages that childcare professionals were able to make during the pandemic. This is resulting in an uptick in program closures. And just note that although states have reported they're seeing increased program closures, there's some concerns around how accurate the data is, because as Nora kind of referenced before, you may have a program that's licensed to have 10 classrooms, but they can only find staff for 6. So they only have 6 open. So we have a lot of reduced capacity that data doesn't necessarily collect. And we're also hearing, as Nora said, many states are reinstating wait lists or even having them for the first time. Another concern that has been brought up to us is that there are some states that are pushing for deregulation. So policymakers are looking at either increasing teacher-child ratios or lowering the educational or age requirements for providers, among other things. Unfortunately, research shows this is actually unlikely to increase supply because a lot of people don't want to take that go over that ratio that they know is really good for them and their children. But it can cause other problems like programs losing liability insurance because now they have more children than they said that they would. And so it also leads to staff burnout and turnover. So while I can understand from a legislator's perspective how it looks like some of these deregulation ideas might increase supply, when it comes down to it, it's not a great trade-off. And we're already hearing from administrators that they're seeing increased concerns around health, safety, supervision, and then overall licensing concerns. Just gonna say,
oh, sorry, go ahead, Emily.
I was just gonna check the questions and see if there were any questions at this point, since we've kind of talked about some of the data. But Nora, if you want to talk about this a little bit.
Yeah, and so folks should feel free to, now that the chat's open, if they want to throw stuff in the chat, if they have questions. We're just kind of going through this kind of quickly. In terms of program closures, we've been tracking that really closely because as the discussion about the pandemic funds ending and what would happen to access for families, there are childcare deserts all over New York. So no one is saying that we are flush with slots by any stretch, but monitoring what our closure looks like, is it more dramatic than when there's a natural kind of churn in the system of opening and closing? So we have not seen, dramatic drop-off of closures in 2024. So we've been tracking, obviously, since the pandemic funding ended at the end of last year. So kind of net change for us as of July that we've actually seen a net increase in 192 programs. So driven mostly in our New York City area, obviously that's where the population is, but across all of our areas, we're seeing a lot of new home-based programs. We have two models for home-based providers. One is for small, which are called family daycare, and then we have group family, which is for 16. And so we've seen an increase in our group family, which usually, sometimes the progression is they go from the small size to the larger size. So that's great. So expanding our family childcare across the state, fantastic in all regions, but also seeing our school age programs and daycare centers open. So we're fortunate we're tracking it monthly and tracking it to make sure we'll get a handle on it. We always need more. The governor just announced our first capital awards actually yesterday. The governor invested $50 million in capital grants to centers and school age programs. We were able to make 45 awards, which will affect a new capacity of about 2,000 slots and expansion, hopefully, of other slots up to 5,000. So hoping all those guys get off the ground and get built and are able to get licensed, and that will help. And those are also all across the state, rural and urban.
Yeah, wow, thank you. Yeah, New York has some great stuff happening. And I think that piece around increasing family childcare, especially, I'm just going to point that out because it's so important. And we're seeing a decline in family childcare across the country. Again, this started well before the pandemic. And so those sort of targeted state investments to improve supply around family childcare are so fantastic. And we do have a question from Camille. What are your thoughts about how to ensure your childcare systems can adjust to the federal changes? That is a very big question. And I think I just want to sort of say in general that in every state and territory, lead agencies are going to have to make different decisions based on who is in their population, what those needs are, and sort of what their funding structures are, whether they have state investment or they don't. It's going to look very, very different from state to state and territory.
And local districts for us, local counties, right?
Mm-hmm.
Because our state system moving to paying based on enrollment, moving to paying prospectively, each of our 58 districts pay providers directly. We don't pay providers directly. So this requires changing 58 systems to pay providers prospectively, which again, New York supports. But each county we need to work with each county on what that looks like in their county, and what that looks like in New York City looks very different what that looks like in Jefferson County in upstate New York. And what that means for their local government, right? How they handle payments, what systems do they use? We don't have a singular system in New York. They each administer through a connected system, but not a singular system. So it does going to vary across the state, again, with the support, but I know all of you know this, but really we need patience. And so we've been talking with our providers and our stakeholders and our advocates that we are all in, but these are complicated systems and these are complicated steps. It took us 2 years just to do direct deposit. And so I think many of us use direct deposit and think, wow, that's great. I love direct deposit. We just got direct deposit just a few months ago. So that took 2 years. This is a much bigger change. So we're working with our local districts, our counties. We're working with our stakeholders. It requires lots of communication and lots of patience. And I would just ask for our national partners and our national advocates on recognizing that I believe most states want to do the right thing here. Most states are supportive of all of the final rule changes. These are very complicated changes. And so the more that we can get partnership on a national level with our advocates, our national advocates, the National Office for Child Care, NASCA is very conscientious about supporting. How can we all kind of drive together for learning from each other, learning from these systems, learning how one state's done it and the pluses and minuses about how they've done it, right? That's what we're all working on together.
Yeah, and I think that was just like a glimpse into some of the many complexities of the final rule. And I do want to just reiterate that every administrator that I have spoken to is really in favor of every aspect of the final rule, that these are ways to build the system for childcare that is sustainable long term. Unfortunately, in the short term, there are going to be some of these are like just technical barriers, some are legislative, and some are just sometimes things take time. And so administrators are working so hard to try to get this done quickly, but get it done right so that we're really building here the foundation of the childcare system that we can use moving forward. Speaking of moving forward.
Good segue.
Oh, we have another question. How are you leveraging technology to accommodate ongoing changes to coming to the programs? Do we have the right systems infrastructure to be agile? I'm just going to say really quickly, Camille, that this is again going to be really different from state to state. Some states don't even have an online application. If you want childcare, you have to print out the application, you have to fill it out, and you have to bring it to an office. So there are some states who are at sort of that level of technology, and then other states who've been investing in their technology systems all along. Typically, these are larger states who have just a little more overall funding. So again, unfortunately, it's gonna the answer is gonna be it varies a lot.
I will say what doesn't vary though, and I just want us all to remember, is the capacity of childcare providers and the capacity of families to use technology. I think there's a big rush right now for states and for localities to get as much technology out there as possible. It needs to be centered with our providers and with our families. So we launched direct deposit in only 10 counties first, and to work with our providers to get them into direct deposit in just these counties, which are not the highest populated counties. It's taking months to just get them to accept it because it's not what they're doing. They need to take care of the children. They know direct deposit and they know their bank and they know all of that, but just to go through the steps. So, as much as I would love to push a button and have this just poof into existence and pay you prospectively, I want to make sure that we're really conscientious about whatever design choices we make are in line with our providers, specifically our home-based programs. We have 10,000 home-based programs in New York, and that's not where the kids are, right? The kids are mostly in centers and school-age programs, but they are our universe, right? And so those are going to be our payments. And they overwhelmingly accept child care assistance, and they work with our families accepting child care assistance. So I would just I want to be mindful that the technology is not the only investment that states really need to make. It's in that change management and in that outreach, so that we're having those conversations and that we're taking it slow. Again, that all takes time. Having lots of forums and lots of meetings all takes time. We have to do that. That can't only be in English. It has to be in the languages that that your providers and your families use.
Thank you, Nora. That's such a helpful context. I think it's really important to remember that. And it's, yeah, there are going to be a lot of moving pieces here for a while. So now what? What do we do? What happens? I think it's really important to acknowledge that the influx of pandemic funds, they did help stabilize the childcare sector. Like that worked. Employment rates are now hovering around pre-pandemic levels, showing that federal investment in childcare really works. It helps lower costs for families, it increases workforce stability, and it strengthens the systems overall. Our brief explores some of the emerging concerns from about a year ago that are really starting to play out now. There are concerns that the structural shortcomings of the childcare sector will further deteriorate without this continued federal investment. And the result is likely to be reduced access to childcare for families, reduced affordability, which means families are less able to participate in the labor market, and that impacts their economic mobility. There are also concerns around some of the varying levels of investment. Some states are really looking to figure out how they can make up for some of those funds, while other states are looking at, decreasing regulations to try to increase supply. ultimately, this leads to disparities in access to childcare across the country. We're in a really tough place right now. Like, lead agencies are working really hard to soften the impact of funding changes at a time when they're also balancing increased investments that are required because of the final rule. So just curious, are people seeing increased wait lists or program closures or pushes for deregulation in your areas? Go ahead and you can put it in the chat if that's something that you're seeing. And we did have one lead agency share with us that they were expecting to serve they were expecting to serve 5,200 less children per month. So we're seeing some impacts here. Ultimately, sustained, predictable federal investment is what we need in order to both stabilize the workforce, because we know providers deserve fair compensation. They deserve a living wage, health insurance, paid leave, and retirement benefits, because this job is very difficult and so important. We also know that family affordability and access are a concerning issue, right? Increasing federal funding is critical because we can expand access to childcare for all families, and it kind of reduces those state to state disparities. We need to create programs that support providers and families, especially in more diverse and rural populations. We also overall, and this is maybe more long-term, but we really need to invest in thinking about how our systems work for families. What do we need to do to collaborate, to align, to make it so that when families come to any of your agencies, it's easy for them to find the care that they need. Families don't care about the funding stream. They don't care if it's Head Start or childcare, or state money. They just want to know, like, where can I take my child that is high quality and safe and somewhat convenient for me? And so this is sort of long-term goals is where we want to get with everybody. That's our presentation. I encourage you, if you particularly like data and numbers, there's more in the brief. And we'll send out the slides. The picture of the brief is also a link to the brief, but you can also use your QR code looker if you like that. And yeah, unless there's any questions, which we're absolutely open to answering through either the chat or Q&A, but I am seeing people are saying, yep, wait lists in Virginia. Colorado's has freezes. I live in Colorado and I've heard parents talking about that. Kentucky serving fewer kids, increasing tuition, and cutting staff salaries. Yeah, that's exactly the kind of thing that administrators are talking about and concerned about. And Elizabeth points out that rural South Carolina, but it is everywhere. It is hardest to find care for children under 2. And that is our most vulnerable citizens. And we also know that the most important brain development is happening in those early years. And parents are really struggling to find high quality and affordable childcare for children of that age. That is one of our biggest gaps in care right now. And I would say that is across the country. There may be pockets where it's not difficult, but overall, I think finding infant care is a big challenge. Yeah, and we're seeing a lot of it. So I think next steps for us are going to be, and many national organizations are looking at, like, what are the impacts? So I think you'll be seeing more about that coming soon from various places, trying to get a handle on the changes, how it interacts with the final rule, and hoping we can find ways to support each other and administrators and families and children. All right, I don't see any other questions. So I will thank you all for coming. Nora, thank you so much for coming and sharing about how New York has experienced this and moving forward, what New York is kind of doing in their state. And yeah, thank you so much, everybody, for coming and learning a little bit about childcare today.
Thank you. Thanks, everyone.
Okay.
You need me.
No, thank you.